This is my first episode with these new, very professional looking headphones. It's very different from, like, I used to just wear the earbuds, but every podcaster that I see wears like these headphones. It's very different. Like, I feel like there's someone squeezing my head. Like, I don't know. It's just weird. But anyways, moving on. Every time someone comes on the podcast, like there's some kind of technical issue. Like, it's never just smooth sailing. But Rachel, welcome.
Thank you. Thank you for having me, RENEE.
So right now you're in BC?
I am. Yes.
Okay, cool. Whereabouts?
I'm doing a locum contract right now in Penticton, BC. I'm here just for a few more days. And then I'll be home for the holidays and starting my new job in Vancouver in the new year.
Nice. And where is home?
Home for me is Calgary and Canmore.
Okay. Nice. And have you spent lots of time in Vancouver?
I've visited friends multiple times, but never lived there. So this will be the first time. But yes, I've visited quite a few times over the years. So looking forward to, a new city, another new city.
So my husband is from Vancouver.
Okay.
Like, he was born in South Africa, but he's been in Vancouver for since elementary school. So his parents are there. So we go there often. My brother also lives there. It is the best. Like, I'm very excited for you because Vancouver is so beautiful. Like, it's lovely. Can I ask what your position will be there?
Yes, of course. So I'll be there at BC Women's Hospital as a nurse practitioner full-time in the Women's Heart Health Clinic and in complex gynecology. And I'll also have about 10% protected time there for research with the Women's Health Research Institute, as well as my position as an adjunct professor at UBC.
That's amazing. Congrats.
Thank you.
Exciting.
I'm excited.
So last night we're having like bedtime issues with our 5-year-old right now. And so last night I can't relax when he's not sleeping in bed. So I took time to like research about you, and I was just like reading a bunch of stuff, and I was like, oh my gosh. Like, first of all, you're 28. Is that accurate?
29. Yes. My brother's in August.
You're 29.
29 now. Yeah.
Okay. So you have a PhD in nursing, and you were named one of the top 25 women of influence for your work in women's and maternal health, and specifically in postpartum sexual health. So my first question, like, that's incredible. So, like, impressive, especially at 29. So my first question that I was thinking is, how did you end up in the space of sexual health in postpartum? Because that's a very niche area.
It is. And it really came from, I think, a combination of interests for me. I volunteered for Options for Sexual Health BC during my undergrad. And that was kind of my first exposure into sexual healthcare and clinical resources for that. And coming into my master's, I remember when I started at DAL, I knew I had an interest in global health and maternal health. I found a supervisory match in Dr. Megan Aston, who held both of those interests as well, which was fantastic. And as I looked into what the gaps were and what I wanted to do for what was my master's at the time, and then bridging into my PhD, I was looking again at a few maternal health topics and thought, I wonder if there's anything on sexual health after birth. And took a look in the literature, and lo and behold, there were many gaps, and thought, okay, this seems like, such a combination of my interests. And then also, of course, sort of filling the gap in some small way through my research. So it happened kind of like that. And has, of course, turned into, kind of an area of passion for me. So
you have not had kids?
No.
Okay. So see, that's what's always interesting to me. Every time I have an expert or a professional on and they do something in the realm of like motherhood or parenting, I'm always fascinated to know whether they became interested in that topic before they had kids, or was it after they had kids? Because like I've had on pediatricians, or I just had on a pediatric dentist. And so I'm always curious. So you have not had kids yet, and you're still passionate about the topic. Like, we love you. Like, that's, I love that.
No, it is. It's great. I think kind of knowing experiences, also kind of being a woman, we can all relate of how sometimes there isn't a lot known about women's healthcare. Things are under researched in a lot of areas or not quite approached in ways that are helpful. So again, knowing that sexual health was a taboo topic, and kind of coming in with that lens, I said, for me, it was something that I really, I think, enjoy and have enjoyed since kind of delving into this topic, because I think for me, it's important to talk about these things, and also kind of share that experience to help, one another. So, it's nice, of course, to have platforms like this.
Yeah. I just saw a TikTok yesterday from a physician that was saying, with regard to clinical trials in health research, it was only in 1993 that it was required to have female participants in healthcare research, which is, adds to the lack of research in women's health. But I found that shocking.
Mm-hmm. Absolutely. And it's true. It's, again, something we're talking more about in health research more generally, no matter the topic, whether or not it's women, particular to gynecology or maternal health or things like that. It's been an issue in all areas of health research, in terms of understanding, some of those differences. And
Yeah.
so again, always important and always more work that's needed. So.
Yeah. So your research focused on sexual health after birth. And I always like to, when I have gynecologists on or people that specialize in these niche areas when it comes to women's health or postpartum care, I like to kind of look at what happens right now with regard to postpartum care. So let's say, what do we do for postpartum women when it comes to sexual health right now? Is there even anything when it comes to our standard of care in Canada? Is there anything that's done at all with regard to sexual health and postpartum?
There isn't a lot done in care right now. One area that, if and when sexual health after birth tends to come up as a topic, it tends to come up at sort of that 6-week postpartum check that people often have with their family physicians or their nurse practitioners, their midwives. And, when it does come up, it's often focused on contraception, which is important, but is very also kind of, I think, very narrow and not always capturing what people actually want to talk about, being, yes, okay, the physical, the safety piece of kind of getting that green light of, okay, is it safe for me to be having sex again? But also kind of those emotional, relational, social pieces. There, are often a lot of questions, and it's not discussed really at those visits typically. So that is kind of one way right now that, again, we see the topic come up a little bit, but it's never really been something that's been a standard of care in any way. And again, is often focused on kind of the, talk of, okay, so we're ready to go on birth control again. And that's kind of where it ends. So that's where my work comes in.
So now I like to ask this question, which is a very let's play imagination. So if we could have, a perfect, someone was like, I'm going to give you all the resources in the world. We are going to totally restructure how we handle sexual health in postpartum. What are some key things that you think should be done for sexual health during that time?
I think with this, starting conversations early is something that I think could be really effective for people in terms of just knowing what to expect. I think when I talk to my participants in this research, a lot of it, I ask them, if you could give yourself advice, a few months ago, or just someone else in the postpartum period, what would you tell them? And a lot of them said, I just wish I knew. I would just wish I knew more about what to expect, or what's normal or not normal, and how there are many variances of normal also. So with that, it kind of brought up the idea of, again, having this information early. As the saying goes, knowledge is power. And so even prenatally having these conversations or during pregnancy of kind of knowing what to expect, having resources available that go beyond kind of that biomedical model. And what I mean by that is, having things like pelvic floor physiotherapy. The people in my research who did access that has such positive experiences with it. And it's something that is right now in Canada not very accessible, because if someone doesn't have private insurance, They have to pay out of pocket. It can be quite costly. So it's not publicly funded at this time, but there are other countries like France where it is. So that also is a huge resource of just kind of having that individual and tailored, knowledge of kind of what's going on with your body, having a partner in care. And then of course, postpartum, knowing that I think as I said, there's so much variance in normal. I think there's always, with a lot of things postpartum, of just like, okay, is this okay? Is this normal? What's going on? There's also this overload of information. So it can be very overwhelming. And with that, those conversations I think can happen more often and earlier on is sort of the message. So
do you find it interesting? After going through the experience of being pregnant, giving birth, being in postpartum, I looked back on it and I was like, wow, I spent so much time and energy looking into and learning about labor and delivery. And I realize now that it was because I was scared of that part of it.
right.
We're seeing these images on social media or like in movies, it's always depicted as this scary, like could be traumatic thing. Like it's very like, the woman's like screaming, it's like chaos. So I put all my time and energy into educating myself about that, taking a labor and delivery course. And then looking back, I was like, oh my gosh, like what I should have been preparing for was postpartum. That's like labor and delivery was like a blip in time. It was like it started, it ended so quickly. It wasn't really in my control because you're kind of, dealt the cards that you're dealt during labor and delivery, and like you want everything to go as best as possible. And it was helpful to know my options and know that like I could have my husband there, my sister, and like things that I could choose and what questions they were going to ask me. And that was helpful. But I was like, oh my God, I should have put so much more into preparing for postpartum. And when you talk to people in postpartum, do other people kind of have that same thought? Like, why did I spend so much time and energy on labor and delivery?
I think it can. They absolutely can. And I think it's different for everyone too, because, when I talk to new moms at, public health centers, or family resource centers, it's often, I'm there to talk about postpartum sexual health. So of course, when I'm there, then it's sort of this open space that welcomes those questions and we can talk about that topic in particular. But it is, I think, even in my research, the difference between first time moms and second time moms in terms of how they experience their sexual health, knowing what they needed, knowing what to ask for, all those things. Because again, you go in with almost no information. And then, if and when you're looking that up, it's like the Google rabbit hole. And that can be scary in itself. But no, I think definitely there can be those themes for a lot of parents for sure. Because you're kind of thinking of all these moments and these milestones of that journey through pregnancy and birth and postpartum. And it's kind of goes back to the question of, as well, of kind of that postpartum period, health wise, we have certain definitions of that of, 6 months or 1 year after birth. But to me, really postpartum in a way never ends. You're you can say postpartum for the rest of your life in a way, So, I think also kind of the length of those issues and that navigation, and there's never really this sort of finite end. It is very much kind of this evolution. So no, absolutely. I think there can be variance there.
I feel like it would be lovely if in early postpartum, there were appointments set up that were just for the mom. Like, of course, the baby, because even in my experience, I was really lucky because my family physician had young kids. And so she had just gone through that herself. So that was really nice. She knew like what kinds of things to ask me, and she did focus on me a lot. I don't know if that's common for everyone, but there was never an appointment where it was like, how are you doing? You know what I mean? And yeah, there was the 6-week checkup, but like that's 6 weeks after, like 6 weeks just seems so far after labor and delivery to be like, oh, how's it going?
Totally.
Yeah.
Absolutely. Yeah.
I was watching your So you were on The Social this year, which is super cool. And if you're in the US and you don't know what The Social is, I don't know if it plays in the US. It's a Canadian talk show. Um, and some of the myths that you guys talked about, I wanted to bring up because I found them to be interesting. So the first one was your vagina won't be the same after giving birth. And it's funny because the audience had lots of, like, it was conflicting. Some people were like, true, some were false. So can you tell us a little bit about that and why that is a myth?
Absolutely. And I think a lot of it comes with sort of mixed expectations of course, seeing birth as this, what can be a traumatic event to the body, which is absolutely true. But also I think with sort of the research and how it's sort of framed in terms of, people's body image, I think also there is this sort of social norm that views the postpartum body or women's postpartum bodies as sort of damaged after birth, in a way that has sort of a negative connotation. And so, for that, I think it's really a big piece in terms of body image and how women view themselves kind of sexually after birth, and also kind of view the function of their vagina or their vulva after birth. I had a few participants who said, it took me a while to kind of see that as a sexual organ again, rather than as something that was sort of for birth and for that purpose. So kind of that meaning coming into it was what came out in my research. But with the vagina itself, we know that, of course, there can be pelvic floor injury. There often is pelvic floor injury from carrying a pregnancy and or giving birth. And that length of recovery can certainly vary for people. Some people have, third or fourth degree perineal tearing from delivery, which, of course, can be something that, again, takes time for recovery. And also, kind of, again, changes. So it's, looking at the vagina itself, that, of course, is sort of the birth canal. That's what adjusts during birth to allow the baby to pass through. But again, a lot of people do continue to experience issues with, things like incontinence. The field of urogynecology, in a way would not exist without childbirth. So, there are absolutely changes. And so it's something that I always want to have a balanced conversation about, because people also, in terms of, their vulva and the exterior kind of thing, can be different. But it's also something that, as I said, it's not this sort of, permanent damage to the body or something that is, sort of seen as, a flaw or this negative change. So it really varies for, every person. So there's no kind of one size fits all answer. But I think there is kind of that myth that, women are so to speak, loose after birth. I hate hearing that word.
Yeah.
But it's something that comes up, right? It's something that's sort of in this like social discourse that we have, these social norms that we have. So with that, it's a myth in the sense that, again, everything does go back after birth. And in fact, a lot of women after birth also can experience, with the pelvic floor injuries, muscle tension, because those are, skeletal muscles, right? Same as your bicep or your tricep. The pelvic floor is made up of skeletal muscles. And so with that tension, in my research, some people were talking about, how they really had, difficulty even inserting a tampon after birth, for some length of time. And so it's almost the opposite, where actually people can experience, tension in the pelvic floor area, and that can, impede or impact, sexual activities as well. So, lots of changes, but that's sort of what people can expect after birth.
I feel like with the tension in the pelvic floor, lots of people assume that, like you were saying, the muscles are weak or it's loose, and that's why they're experiencing issues. When in like reality, if you go to a pelvic floor physio, chances are it's that they're tight, and it's, you actually have to work on learning to loosen those muscles and not clenching all the time. Like I remember, oh my gosh, when Milo was like 18 months old, I went to see a pelvic floor physio, but I was lucky in that I saw one when I was pregnant as well.
Great.
So I was like, like my friend happened to be, she worked at a clinic. She's a chiropractor, and her colleague in her clinic was a pelvic floor physio. And I was like, oh, hey, like I'll go see her. Like I learned about what they do, and I was I was like, wow, that is incredible. So I went and I learned so much about like doing Kegels properly, and quickly realized that my muscles down there were super strong, but I needed to learn how to like release the tension
Mm-hmm,
almost.
mm-hmm.
And so oftentimes, is it true to say that painful sex after, like in postpartum, could be related to like the muscles have just gone through almost like a trauma, so they're tense, and that's what's causing the pain?
Absolutely. It can be an issue for sure. And yeah, so pelvic floor physiotherapists are great resources. They're the experts in that, which is fantastic. But yeah, same as if you kind of pull a muscle or things like that. Oftentimes you have the tension afterwards to sort of make up for that injury that's happened. So it can be the same after birth. The pelvic floor injury, again, varies for every person, but usually there is some sort of impact that, again, takes time for recovery. And also with pain during sex, you know, if people are breastfeeding, vaginal dryness can be a huge issue that people don't always know to expect. So that's another thing that kind of comes up quite a bit, I find, in terms of, painful sex after birth.
Oh, I didn't know that was a thing. Breastfeeding, like, is like causes, or it's common to be dry if you're breastfeeding?
Yes. Yeah. So it's the effect of a few hormones.
Oh,
There's, you know, when you're breastfeeding, you have prolactin, oxytocin, progesterone, which is the main culprit in terms of that. So yes, people often struggle with vaginal dryness during that period if they are breastfeeding. So I always have that conversation about tools that we have, lubricants, vaginal moisturizers, all those
yeah.
things, again, to sort of help with that because it is quite common.
Oh, I did not know that. See, we learn something new every day. Um, okay, the second myth was that at 6 weeks postpartum, we should be ready for sex. And so let's talk about that 6 week checkup, why we do it, what it means. Because I think there's I remember making a TikTok a long time ago about the 6 week check. And it was something along the lines of like, your doctor at the 6 week check is like, oh, okay, like you're ready to have sex again. But then I was like, excuse me, like I will tell you when I'm ready to have sex again. Thank you. um, so yeah, let's talk about that 6 week check because I think there's still a lot of, misinformation, or people assume things about that checkup and what it actually means.
Absolutely, absolutely. And the participants in my study, I think, echo a lot of what you just said. I think there was that piece of valuing what the healthcare provider said in terms of sort of that lens of safety of, okay, is it physically okay? Am I recovered? Um, is it, safe for me to be, having sex again? But also that internal voice of, okay, I'm being told that I'm ready. Physically, I'm recovered. But those things like, subjective experiences like pain, like sexual desire, all those things, you're the only one who could be the judge, right? So it's
Mm-hmm.
tough, I think, to navigate that when you sort of have these external messages of, okay, I'm safe. I have that, that green light or that green check mark, but I'm not feeling ready. And so that's really where that theme came in my research of trust your gut, because it was kind of that internal knowing that people had to rely on and trust. And kind of, it was difficult. I think the 6 week check means a lot of things to different people. And that meaning, in terms of what my research showed, was that the 6 week check can feel for some like a bit of a return to normalcy of, okay, we made it this far, bit of a milestone in a way. So it can have that positive connotation, but it also can be more negative in the sense that it feels like a bit of a deadline, in the sense that it feels very rushed. It feels like it's very arbitrary. It feels like it's too soon. So again, there's sort of that variance in terms of when people are going to feel ready for sex after birth. There is no right or wrong time. But the 6 week check really is kind of socially positioned or seen in a way that, it should be, again, that check of when you're feeling ready. But it is not a one size fits all. And that's kind of what my, research showed and what I kind of aim to, in terms of myths, what I aim to dispel. Because I think a lot of times, sex, if and when it comes up at that 6 week check, it's sort of more with the aim of convenience. and also with the physical pieces. So, at that 6-week check, oftentimes we're looking to make sure if there's any, perineal tearing that's happened or episiotomies to see that that has healed. By that time, the uterus has gone back down to pre-pregnancy size. So there are kind of some of those, again, physical things that we're looking for to ensure that, everything is going okay after birth. But really, in terms of sex, there's so much that goes into it that is not just the physical piece. So I think people, when I talk to family physicians or gynecologists, nurse practitioners, when I lecture or do presentations, it's often something that I talk about because, again, there's that expectation of kind of getting that approval from the healthcare provider, but then how we navigate that after is sort of something that we don't talk about. And even having that conversation with our partners at the 6-week check, I had a few participants who said, kind of that they went into that visit with a little bit of a sense of dread of, please, can I have more time? Please, can I have a couple more months? Like, I'm not ready. And then what am I going to say to my partner also after? It sort of brings up this, I think, difficult piece of, well, the doctor says I'm okay, or the midwife says I'm okay, but I'm not really feeling this way. And I think, what can be difficult about that especially is sort of sometimes almost that feeling of needing to explain yourself, if that makes sense. And that's tough.
Yeah.
So the 6-week check is, really, it is. It's a big moment. When I talk to people in my research, it was something that really surprised me, in terms of not the fact that it was a moment, but how impactful of a moment it was, because it came up when I asked people, what was a moment after birth, whether you were in the shower, you were in the grocery store, what was a moment when you thought about your sexual health after birth? And every single one said, you know what? The 6-week check. So that was impactful because it really was such a moment for people.
My understanding about the 6-week checkup was that it has something to do with the amount of time that it takes for tissues to heal properly. Is that accurate?
Yes, generally. So again, things like perineal tearing, if people have experienced that, we'll assess that, and the uterus going back down to size. So yes, all those pieces are sort of there.
And so along those lines, it was basically saying that your risk of infection moving forward is extremely low, or like non-existent after the 6-week check if everything was looking okay.
Yes.
Okay. And so did you see anything or do any research or read about, because I was hearing a lot during COVID that a lot of women didn't even do an actual physical check. It was like a FaceTime appointment or like a Zoom call at a 6-week check, or they didn't have one at all. Was that did that come up at all?
It didn't generally for my participants, simply because I think each of them did have a 6-week check. But we know that it is an issue because, of course, as is common we hear in the news, the lack of primary care providers for a lot of folks. So they're often connected with, gynecology teams or midwifery teams, which is, of course, very important. But often sort of after that 6-week mark are discharged from care. So it sort of leaves some of those issues that people might be experiencing beyond the 6-week mark, which can be many, without sort of an attached primary care provider or attached care provider who's seeing them. So, it is definitely an issue in terms of the support that's provided for people postpartum. But in terms of the 6-week mark, again, everyone in my research was able to have that visit. But even kind of, I remember one going back at 6 months, and because she was experiencing issues with sexual activity and still having pain during that time, and went to her family physician and said, I'm still having issues. So was sort of seeking help or seeking treatment, and was told to use Crisco and come back at the 1-year mark if she was still having issues. So it's also kind of an important conversation because people can be brushed off with this. My research was done in 2020 and this is still an issue, right? So being taken seriously, we know in women's health and gynecology more generally, is an issue, and that women are not believed when they come presenting with health issues. Their concerns are dismissed or, kind of minimized. And it's no different in the postpartum period. So luckily, the participants in my research again spoke positively, mostly, about their healthcare providers, about their partners. But it can be an issue as well in terms of teaching healthcare providers how to have these conversations. From my lens as a nurse practitioner, as a PhD prepared nurse practitioner, I have these conversations with, physicians, with nurses, with a variety of health professions. Because it's important to kind of understand that they understand how to approach these conversations as well, because sometimes that's also the gap, is that, they haven't been provided the education to meaningfully care for sexual health after birth. And so again, having that education piece also, I think, can help things be, opened up on both sides.
Do you think there's also a piece of like the women seeking treatment knowing how to advocate for themselves? Like, I always feel like in a healthcare provider situation, especially when you're feeling already so vulnerable in postpartum and experiencing all these different things, there's almost like there is a power imbalance when you go into a healthcare provider's office, like on a normal day. But now, like, add in all the things that you're experiencing in postpartum, and now trying to seek help for something that's maybe like a taboo subject or something that's not talked about, something that none of your friends like told you about. So you think you're the only one. It's like there's so many layers of making it difficult to bring these things up, to seek help. And then if you're not getting the answer that you want from your provider, to advocate for yourself or go get a second opinion.
Yeah, definitely. No, it is. It's a big issue because I think already kind of going into those, conversations, it's postpartum, there's always a lot going on. And that 6-week check also, can often feel quite rushed because there's so much to check. We're talking about physical health and mental health and all this stuff to cram in. And then, okay, do you need birth control? Okay, let me write a prescription. And that's kind of it, you know what I mean? And so before it's, it feels like it just started, and then before you know it, it's over. But you're still kind of left with, okay, I actually have quite a few questions for you. And that sort of feeling as well. So the system in itself is not exactly structured to help clinicians provide, I think, the care that they want sometimes, and help patients get the care that they need. So you bring up a very good point in the sense that, I think there's an issue on both ends of, how do we again, engage in that impactful care in ways that again can be meaningful to people. Yeah, but no, I think coming in as the patient, there is, unfortunately sort of that inherent hierarchy or structure that we sort of expect. So with that, I think there is literature to say that supports that people do often expect their healthcare providers to be the one to bring the topic of sexual health up with them and be the initiator of that conversation. However, it's known also that healthcare providers often don't know if or how to bring it up and then how to have that conversation. So it's difficult because also if and when you do bring it up, I think it takes courage, I guess, in a way. But it's also difficult when that is brushed off, if that does happen. Because again, you feel so vulnerable and you're asking for this help, and even that can take a lot and be difficult to do. So if and when people bring it up, again, being listened to, I think is, I've seen and worked with wonderful healthcare providers who are so great at this. But that's not necessarily something that can be accessible to everyone. And, we have issues with that as well, in the primary care setting. So, it is. There are definitely multiple barriers there for sure. So I think starting with healthcare providers being the one to bring it up and really ask about it. And so when I, give practical tools to, family physicians or whoever it is I'm presenting to, I always give them just those simple one-liners of, asking patients, so how are you feeling about your sexual health right now? Or what's going on for you? What are your thoughts on your sexual health right now? And that way it sort of opens it up to have people bring forward what they want to bring forward. So whether that's the physical pieces, contraception, or the emotional pieces, the relational pieces, it lets them be the ones to define sexual health for themselves. And that was also the approach I took in my research, because we know that sexual health, as I've said, and as is defined by the World Health Organization, it's physical, it's emotional, it's relational, all those components go into it. And so when I asked, participants about how they experienced their sexual health after birth, it was up to them to define what was included in that. It didn't necessarily need to be about sexual activity. It could be, but it didn't have to be. And same with patients. So I always kind of tell providers, or help guide them in that way in terms of having, those practical ways of, okay, how do I bring this up? And leaving it be leaving it open to be what the patient wants to bring forward. And that also helps to offset those dynamics of, power or whatever it is in the interaction, because it's letting them bring forward what is important to them rather than having us be the ones to decide what's important to discuss.
The provider asking that question is also so powerful because it's sending a message that not everyone is ready right now. And there's lots of things that go into it. Like, it almost lets the patient know that it's okay if everything is not totally fine and you're ready to resume, being sexually active and whatever it is. It's like, otherwise, if nobody talks about it, we're just kind of like, oh, okay, like I should be fine and everybody else is fine, obviously. So even just asking that question just kind of like paints the picture that, you don't have to be fine right now and ready to be sexually active. So I love that. Yeah.
Definitely. No, it's an important message.
Yeah. The third myth, which I loved, was that sex can be better after having kids. And I feel like a lot of people were like, oh, what? But that was true. That one was true.
Yes. And again,
so can
I think
you talk a little bit about that?
Yeah, there's that myth again that having babies and having a family is going to completely, ruin your sex life or whatever those sort of, again, thoughts people might have. And it is, going into a period where you don't know what to expect. You hear all these different things, all these different experiences. So you're kind of landing with, okay, what is my experience going to be like? So I think that fear, in a way, or that fear of the unknown is fair. But with, I think sexual health after birth, that process of sort of pregnancy and giving birth and all those things, in terms of not only your own journey as a woman, and if your partner's involved or, if you have a partner, also kind of that journey and, with them. It's powerful because I think also that awareness of your body, seeing kind of what your body can do. I think a lot of people in my research said, even though I'm doing all the recovery work right now, it was pretty awesome what my body was able to do. And so there is, I think in a way also that sense of confidence that comes with, again, carrying a pregnancy, giving birth, this amazing, amazing thing that, our bodies are able to do as women. So, and then that kind of relationship with your partner again evolves. It can feel like a bit of a roller coaster and a lot of adjustment. But also, enhances that sense of, bonding and intimacy in terms of, again, just what a journey it is, the ups and downs within that, and how you can sort of, again, go through that with a partner, without a partner, whatever your journey is. But yeah, I think also kind of that awareness opens up and that those conversations open up about kind of the realities of life, life postpartum. So people, I think, can sometimes be, a bit more open to talking about, okay, this is what my needs are right now. And sometimes that's sort of the first time where it is, again, you're navigating something that's so new. And there is no recipe book for what it's going to be like for you. So that, again, that theme and that, topic of trusting your gut and being aware of, what you're feeling physically, emotionally. I think pregnancy and postpartum are definitely sometimes a bit of a teaching journey in that way. Those, life lessons that we have of getting to know ourselves better, getting to know our partners better. I think that plays into it in terms of, the, how people experience sexual health after birth. And yeah, how sex can be better after birth. There's no kind of, again, one size fits all, but I think also there's, this myth that, persists that it's, going to ruin your sex life or whatever that is. So, as I said in my interview on the social, and I say now, it's important, I think, to see sexual health and sexuality as an evolution throughout the lifespan rather than something that is positioned as either, positive or negative. It's always evolving.
Mm-hmm. Yeah. Like it's not this consistent thing. Like my husband and I, when we were dating, it was a little bit different. We didn't have a child. We didn't live together. We didn't, have all the logistics of like running a household. Like it's totally different.
Yes.
Like sex life is not consistent, but either is your relationship. Like I feel like we've always been like best friends. We work so well as a team, but like the newborn phase was different for us. Like our son is 5 now, like that's different. When Milo is 15, our relationship is going to look different. Like, and I think there's so much pressure on couples to maintain the relationship and the sex life that they had before they had children. And it's like acknowledging the fact that those things are going to ebb and flow and look different. And that leads me to the next thing I wanted to ask you about, which was one of the key findings, which I loved, was redefining intimacy. And I just did a whole solo episode about like sex and intimacy post having children. And I talked about almost like that topic and how it feels to me, especially with social media, there's all this pressure of like having sex constantly, you know? And it's like, I started to question myself. I'm like, okay, do I actually do I want to have sex? Or is it just people are telling me that I should want to have sex all the time? Because honestly, once Milo goes to bed, I'm tired and I want to go read my Kindle and I don't have a desire to like have sex. Feeling connected and close to your partner does not equal just wanting to have sex all the time. Like a relationship and having, you know, a romantic attachment and like a bond to your romantic partner does not equal just having sex all the time. And I even talk about how my husband and I, since having Milo, started to sleep in separate beds. And even like that is so common among couples. You wouldn't believe it. Every time I talk about it on social media, people in the comments are just like, oh my God, me too, me too, me too. Like, but nobody talks about it because we're worried that other people are going to judge us and think like, oh, we don't have sex ever, or like, ooh, there's something wrong in their marriage. But sleeping in the same bed does also not equal a healthy, you know, bonded relationship. So can you speak a little bit to the idea of redefining intimacy, especially in postpartum?
And you bring up again a great topic because it's something that was a big theme in my research, and that we hear conversations happening more generally about it too. So as you said, definitely participants in the research. I had a few who said I think one was at the 2-month mark, and she said, I'd be scared to tell people that we haven't had sex yet because they would think something's wrong with the relationship. Because society sort of expects that of relationships, is that, again, you're sexually active together. But also kind of there's this social discourse as well that positions sex as sort of the, best or most valid way of showing intimacy or sharing intimacy with your partner. And so again, there's sort of, again, these norms, these expectations within relationships, and that fear of being judged if and when that's not happening. And for people, I think it really is postpartum or any period in life, really, that they're navigating, kind of what works best for them and their partner. That's not for anyone else to decide, But it is, I think postpartum, it's an issue not only in social conversations, but in sort of from the research lens as well. Because when I was looking at sort of what had been done in this area prior to beginning my study, a lot of the studies that looked at sexual health after birth were looking at things like sexual initiation. So first sexual intercourse, when did that happen? At what point postpartum did that happen? And also frequency of sexual activity were some of the common measures that were used to sort of measure sexual health after birth. And for me, yes, okay, that can be part of the picture, but there's really so much else there that goes beyond how often you're having sex. To me, that is not how I define sexual health. Again, that's my personal opinion. Some people might disagree. But redefining intimacy was important for people in this study because it was a way for them to, again, meet their needs and be aware of their needs. Often they talked about, cooking together, flirting, joking, having time alone, just the two of them was very nice, to just sit on the couch and just talk or cuddle, or kiss or whatever that was, and just spend time alone together without, kids or without baby. So yeah, people really, I think it was important because they sort of enacted agency in that way of saying, hey, okay, this is sort of what our needs are right now. That may or may not include sex. And oftentimes in the, postpartum period, it didn't necessarily include sex, but it was about, for them, the important pieces were maintaining that emotional closeness with their partners. When, I asked people what was important, to them, that was the main thing. So they found ways to still maintain that intimacy, that sense of teamwork, that closeness, in ways that doesn't necessarily need to include sex. And again, that's powerful because what society tells us about relationships is often kind of the opposite, where it is very much about sex, or when did you guys first have sex, or how often are we having sex, all those things, right? And sex can be great. That's great if that works for people, and that is how, you know, they want to maintain that intimacy postpartum. Again, nothing wrong with it. But I think it's important to also talk about the changes and how sexual health is not necessarily measured based on how often you're having sex.
If you could say anything to the partners of women in early postpartum, to like, if we were just going to like broadcast this to all the partners in the world whose, you know, their partners have had babies and they're in early postpartum, what would be the message that you would say?
I think there's a few pieces to it. So when I talk about this, it's, you know, the physical pieces and the emotional pieces. And in my research, the participants did often talk about having supportive partners, which is fantastic. And a lot of it kind of came down to feeling like they could speak openly with their partners and that they were listened to and that their needs were respected. So whatever they were kind of telling them or saying in terms of, you know, sex or return to sex, often it was sort of like, it's not you, honey. It's just, I'm not ready. Things like that. But it was, you know, in terms of kind of, I think what partners can do is, of course, be that supportive person, be non-judgmental, and welcome those conversations without, of course, feeling pressured. So luckily, none of the participants in my study felt pressured by their partners. But we know that that can be also kind of a common issue of, again, the expectation of, you know, the 6-week check, and, you know, there's that excitement building and, okay, this means we can, you know, have sex again. And that's often kind of can be a bit scary for people who have, you know, given birth and things like that. So the sense of humor also was an important piece, I think, if and when returning to sexual activities. It can be awkward, it can be different and messy and all these things. So being able to laugh with each other, I think people also found different. So that's something I would say to partners, is to be open to whatever that looks like. You know, with breast changes, people kind of can feel different about having that area touched. Oftentimes there's, you know, breast tenderness or breast soreness if they're breastfeeding. They can have leakage as well, especially when they're aroused or climaxing. There could be leakage. You know, some people talked about, you know, oh, I don't want my partner to view my breasts as being for breastfeeding, you know, while we're having sex. Like, it kind of, you know, it's different because people are often kind of navigating the fact that they see their bodies quite differently postpartum, and those parts that they might have seen as having solely a sexual function prior to pregnancy, that sort of shifted after birth as well. So for partners, I think, yeah, just being very open to honest conversations, listening with empathy, not putting any pressure on anyone at any time, and taking things slow with the physical pieces, taking it slow, being open to the fact that things might feel new. You might have to figure out what positions work, or, you know, introduce methods that you didn't use before, or all these things to kind of help both of you have, you know, a positive, fulfilling sexual relationship. So again, the changes are unique. It depends what you'll be navigating. Everyone's different. Every couple's different, but those are kind of, I think, some common issues that people have after birth.
Do you think it's worthwhile for someone's partner to, before the 6-week check, just it's worthwhile for them to have a conversation about how they understand that the 6-week check doesn't necessarily mean that they're going to start to initiate sex again, or, you know, intercourse? Do you think that is a conversation that partners should be having, just to kind of ease the anxiety about that 6-week check, and opening the conversation to the fact that that doesn't mean, just because I'm maybe not going to get an infection doesn't mean that I'm emotionally or physically still ready to have sex?
Definitely. I think it's worth having that conversation at any time throughout pregnancy, postpartum.
Yeah.
You're navigating what are, again, through pregnancy, lots of physical changes throughout that time, throughout those 9 months. And then postpartum is the same thing. So with that, again, the pressure, I think, was sort of felt, not necessarily, you know, spoken, but it was something that, you know, people getting that checkup, postpartum women or a feeling of sort of like, oh, okay, I feel like this is kind of an unspoken expectation here and I'm not feeling ready. So they felt kind of the need to bring it up afterwards with their partners. But yeah, I think always approaching that again with empathy and just wanting to understand the other person's experience. So saying something like,
Mm.
hey, I know we have that 6-week check coming up. I feel like oftentimes this is kind of seen as something that means that people are ready for sex. And that is, something that I don't think really necessarily fits with everybody. So I just want to check in. How are you feeling about your body, about your changes, about sex itself? I want to understand your experience and know that there is no pressure with anything. We can take it at our pace.
Yeah.
And, preface with that of, again, just wanting to understand each other's experience. I think that really shows love and affection in such a deep way where we open that up to say, hey, I understand that maybe this is something you might have on your mind. Let's talk about it. So again, never too early to have those conversations. And I think partners are, again, supportive in so many ways during that period. And sexual health is no different. They have an important role to play in sort of navigating that and being okay with the changes that may come. So.
And I feel like keeping the conversation open and continuing the conversation kind of takes away I don't know, not like the shame, but almost like the feeling of like wondering what the other person is thinking, like,
Definitely.
So if you're 11 weeks postpartum or something and you're not initiating sex, you're like sitting over there thinking that your partner's like, oh my God, like what's going on? So if you're keeping the conversation open, it's like nobody's guessing what the other person is going through. Yeah.
No, it helps
I love
a lot.
that.
And I think also it brings up another point for, postpartum women and their partners is also that sexual health after birth and sexual activity in particular is not sort of this like linear path to feeling ready of, okay, we're at this point, I'm ready. It's going to be that ebb and flow. It's going to be back and forth. So I think also that's an important piece where, okay, again, when it's what I find is problematic about measuring sexual health is kind of maybe the first time that people engage in sexual activity. When does that happen? Because it might go fine. It might not go so fine. It might be kind of like, okay, that didn't feel how I expected, or that didn't go how I expected. So there is very much that ebb and flow also of, it's not just, okay, we're starting to have sex again. We're sexually active again. All those sorts of things. It's for people in my research as well was kind of this process of figuring out, okay, what's going to work. For some, that meant, self-pleasure or masturbation prior to engaging in sexual activities with their partners, which I thought was great. For some, again, it can be introducing new positions or new, tools like, vaginal lubricant, things like that. So yeah, that's also the other piece as well, is sort of to know that it might be a bit of back and forth and in that sense.
Mm-hmm. For sure. I feel like that's everything. Like not many things in life are linear. Let's just
Exactly.
say that.
Exactly.
So this was a fabulous conversation. I'm curious what your plans are for the future. Like, do you have research ideas in mind, or, are there particular things that you're looking forward to doing?
I'm, I think very fortunate in the sense that I get to have a research, piece to the work I do. And also that clinical lens as well. I love the combination and feel so lucky to be able to, engage in women's health research in that way. So, with this work, I developed a patient education tool on sexual health after birth, that's now used on, all postpartum units across Nova Scotia and much of the Maritimes. It's also in family resource centers, family doctors' offices, places like that, as a way to initiate that conversation. So now we have a tool to kind of start that off. So it helps healthcare providers and patients. So with research, I think there is more needed, of course, in this area. My interest focused, largely on maternal and women's health and gynecology, more generally. So I think with this research, a continuation could absolutely be, I think, looking at sexual health past the 6-week mark. My research, I interviewed women who were between 1 and 6 months postpartum. And even at that 6-month mark, some people definitely were still actively navigating issues. And so I think looking at sexual health from even a more longitudinal perspective would be helpful in terms of contributing to the literature. And then, yeah, in terms of care, I think trying to help these conversations happen, whether that's prenatally or postpartum. So educating healthcare providers, lecturing, presenting, I do that quite a bit, and developing, again, the tools and example of ways to, practical ways that I think will help open things up in terms of conversations about sexual health after birth. So yeah, again, always looking for ways to improve, but my work, largely right now is focused on how can we impact clinical care with this research. It's no good to, just publish it in the journals. That's great and fine too, but that's all academics who read that. It's, not necessarily accessible and in that way. So for me, I really look at, the knowledge translation piece as being important, in terms of how do I affect frontline care? How do I, shift care, based on the work that's been done and the work that I hopefully will do in the future. So again, having that lens as a clinical provider, I think is helpful in that way. So yeah, we'll see where things go. But being a BC Women's, I think, will be a great base for me to hopefully impact care, not only in the province, but across Canada as well through policy development and my role on, certain boards or committees and things like that. So.
I love it. And you get to do it all in beautiful Vancouver.
Yes, yes, I'm very lucky.
Are you on social media? Like, do you have an Instagram account or anything?
No, I'm a bit of a dinosaur in that way.
You might be the first person on the podcast.
Yeah, I'm not surprised. Yeah, but no, I am technically on Twitter, but don't check it a ton. But no, I don't have Instagram or TikTok or anything like that. I do have a ResearchGate profile if people are interested in the publication piece. There is that for looking at some of the publications, but otherwise, no, I call myself a dinosaur in that way.
Oh my God, I love it. You're like a true academic. Oh.
We would expect nothing less.
I know. I love it. Okay. Well, thank you so much for, coming into the mom room and talking about this extremely important topic that I don't think enough people talk about. So it was a pleasure to talk to you today.
Yes, you as well. Thank you so much for having me on, RENEE.